Hello to everyone. Good morning from Paraguay. Next slide, please. Yes, I am a PhD candidate. I gonna tell you about our study, the inclusion of artificial intelligence in the TB screening in prison. Next slide, please. Next. Okay, tuberculosis screening with Prinose and CAT4TB in Paraguayan prisons, Prinose study. That is our clinical trial number, and our primary objectives is to assess the value of Prinose to diagnose the TB in prison. Next slide, please. Of course, all you know that the TB is a huge problem in the world. The treatment is free, but still leading the cause of death from a single infection agent. Next slide, please. So why in the prison? Why we perform this study in the prison? Next slide, please. There is a study from Paraguayan investigators that found the relative risk of tuberculosis in prison compared to the community was 17.3. So prisons represent a reservoir for the spread of disease to the rest of the community. I work in the respiratory hospital. It's a 4-level hospital, and almost 70% of the patient was with TB. Know somebody or have a close person who had TB who was in the prison. So that is the explanation. We need more affordable point of care for point of care tests that are suitable for low resource setting where TB is more prevalent are urgently needed. Next slide, please. So we see only a little part of the really picture. Next slide. Next. Our objective is to assessment of the sensibility and the specificity of the Prinose and its utility for mass TB screening. Evaluation of the feasibility and utility of CAT4TB digital X-ray as mass screening tool for TB in high incidence settings, and identification of factors that affect the diagnostic accuracy of the Prinose and of the CAT4TB. Next slide. So how we do that? Next slide. Our study compared the Prinose to conventional methods of screening and CAT4TB. Next slide. First, the prisoner sign an informed consent. The inclusion criteria are that must to be a prisoner or are employed of the prison more than 16 years and sign the informed consent. Next slide. We divide the study in five steps. Next slide. First, in the first station, there is a nurse, a study nurse, and the paper with the informed consent. Once first the participants sign the informed consent, we talk the vital signs, medical history, medication, question about substance abuse. In the second station, we perform on the picture, the X-ray, and the CAT4TB score. We have the version 6.0, and cutoff point is 65. In the third station, we use the Prinose, the electronic nose device. In the fourth station, a medical check with a history and a physical exam. And then in the fifth station, if the patient has a positive sign or symptom of tuberculosis or had a CAT4TB score more than 65, requires a sputum sample, two sputum samples, one for the ultra, for the expert, and another for midget and low antigens and culture. The sample is 40,000 participants. We have maybe 2 or 3 weeks more to end the study. Next slide, please. This is a video message because the high percentage of the prisoners are illiteracy. So first they saw a picture, a cartoon, where the cartoon explained all the process. Next slide. After that, next. After that, they sing if they want to participate, the informed consent, and we give them a number. We don't use the name of the participant. It's a ID number. Next. That is the informed consent with the code. Next, please. This is the first station. There is the nurse. We took the vital signs, the blood pressure, temperature, height, weight. Next slide. In the second station, a technician will perform the X-ray and will process the digital image with the software, with the CAT4TB software. Like I said before, our threshold score is 65. Next. As the WHO say since the 2022, endorsed to use the X-ray computed automatic detection CAT in the TV screen. Next slide. It's very quickly, very easy to use. Next slide. The third station is the e-nose station. It's an electronic nose device. The participants stay there for 5 minutes. Next slide. And in the fourth station is the medical consult. A doctor will take the history of symptoms or signs of tuberculosis and decide if the patient maybe have tuberculosis or not by the physical exam or by the score of the CAT4TB. Next slide. In the field, samples. One is for the ultra or the expert and the other for the midget culture. Next slide. The X-ray machine is very easy to transport. It's very easy to examine. Does not require constant connection to the electrical network. That is a excellent stuff because in the prison is very awful. Yes, it's easy to use, but we found that the structures, the support is not too durable. Next. Next. If you can, we must say you need to buy the CAT4TB box. We didn't buy that, so we need a stable and fast internet connection to use the CAT4TB score. Most prison here don't have it, so it's a word delay. Next slide. But we can solve. Next. Thanks to the help desk, is the solution very quickly, very easy. I think we know most of the technician. Next slide. So every time that we move to another prison, we talk to the help desk and then configure all the stuff with the new internet connection. Next slide. Next. This is our actual status. We start in October 2021. We now are in our 5th region. The name is Takumbu. Many cases of TB we detect. Our prevalence is around 6% in the national numbers. The national TB program has numbers that the prevalence in prison are around 3 or 4. So thanks to this study, the prevalence is more. And we think we gonna stop the inclusion maybe the last week of July, the next week, or the first week or August. Next. And the numbers, we already have the numbers, but in the publication you're gonna see. Next slide, I think is the last one. Yes, thank you.